Neuropathic pain, often described as burning, tingling, or electric shocks, affects up to 10% of the population. It arises from damage or disease impacting the somatosensory system, leading to chronic discomfort that can be difficult to manage. Common causes include diabetic peripheral neuropathy, postherpetic neuralgia, and nerve injuries. Patients often struggle with daily activities, sleep, and mood due to persistent pain. Despite various treatment options, less than half of patients achieve adequate relief with a single medication. This challenge has driven the search for more effective and safer therapies, especially for those who do not respond to standard treatments. When it comes to treating neuropathic pain, several medications are recommended as first-line therapies. These include gabapentinoids such as gabapentin and pregabalin, tricyclic antidepressants, serotonin, norepinephrine reuptake inhibitors, and topical agents like lidocaine patches. Each of these works through different mechanisms, aiming to reduce pain signals in the nervous system. However, even with these options, many patients find that a single therapy does not provide enough relief, highlighting the need for combination approaches. Understanding these first-line options is crucial for tailoring treatment to each patient's unique needs. Despite the availability of several first-line medications, monotherapy, using just one drug often falls short. Studies show that fewer than 50% of patients achieve meaningful pain relief with a single agent. This is partly due to suboptimal efficacy and dose-limiting side effects, such as sedation, dizziness, or dry mouth. As a result, many patients either switch medications or add a second therapy in hopes of better results. The limitations of monotherapy have led clinicians to explore multimodal, or combination, therapies to improve outcomes and quality of life for those living with neuropathic pain. Monotherapy often inadequate, combination therapy has become increasingly common in clinical practice. By using medications with different mechanisms of action, clinicians hope to achieve additive or even synergistic effects, improving pain relief while minimizing side effects. For example, combining a systemic agent like a gabapentinoid with a topical agent, such as a lidocaine patch, can target pain from multiple angles. This approach is especially valuable for patients who have not responded to single-drug treatments, offering new hope for better pain management. While combining systemic drugs can enhance pain relief, it also increases the risk of drug interactions and adverse events. For example, pairing gabapentinoids with opioids or antidepressants may lead to higher rates of sedation, dizziness, constipation, and even dropouts from treatment due to intolerable side effects. These risks can limit the effectiveness of combination therapy and make it challenging for patients to stick with their treatment plans. Therefore, finding safer combinations is a top priority in neuropathic pain management. Topical lidocaine patches offer a unique advantage in combination therapy. Unlike systemic drugs, lidocaine patches act locally at the site of pain, minimizing systemic exposure and reducing the risk of widespread side effects. Clinical guidelines now recognize lidocaine patches as a first or second-line option for neuropathic pain, especially for conditions like postherpetic neuralgia and diabetic peripheral neuropathy. Their favorable safety profile makes them an attractive choice for patients who cannot tolerate or do not respond to oral medications. Lidocaine patches deliver a local anesthetic directly through the skin, numbing the area and blocking pain signals from reaching the brain. This targeted approach allows for effective pain relief without the systemic side effects commonly seen with oral medications. Patients can apply the patch to the most painful area, and the effects are usually mild and transient, such as slight redness or rash at the application site. This makes lidocaine patches a practical and well-tolerated option for many people with localized neuropathic pain. Several clinical trials have evaluated the effectiveness of lidocaine patches, both as monotherapy and in combination with systemic agents. Studies show that when patients with neuropathic pain do not achieve adequate relief from gabapentinoids alone, adding a lidocaine patch can significantly improve pain scores. Importantly, these improvements come with minimal additional adverse effects, supporting the use of lidocaine patches as a safe and effective add-on therapy. Researchers have compared different combination strategies for neuropathic pain, including gabapentinoids plus opioids, gabapentinoids plus antidepressants, and gabapentinoids plus topical lidocaine patches. The results are clear. While systemic combinations often increase side effects and dropouts, adding a lidocaine patch to gabapentinoid therapy improves pain relief with fewer risks. This evidence supports a shift towards safer, multimodal approaches that prioritize patient comfort and safety. Combining gabapentinoids with opioids has been studied in several trials. While some studies show improved pain relief, others find no significant difference compared to monotherapy. More concerning is the consistent increase in adverse events, such as dizziness, somnolence, and constipation, leading to higher dropout rates. These findings highlight the need for caution when using systemic drug combinations and underscore the importance of safer alternatives. Similar to opioid combinations, pairing gabapentinoids with antidepressants can sometimes improve pain relief, but often at the cost of increased side effects. Patients in these studies reported more frequent dry mouth, dizziness, and fatigue, with some needing to stop treatment due to intolerable symptoms. The inconsistent benefits and higher risk of adverse events make this combination less appealing, especially when safer options are available. In contrast, studies combining gabapentinoids with lidocaine patches consistently show improved pain relief with minimal additional side effects. For example, one trial found that patients who added a lidocaine patch to their gabapentin regimen experienced significant reductions in pain intensity and interference with daily activities. Most side effects were mild and localized, such as skin redness, and did not lead to treatment discontinuation. This combination stands out as both effective and well tolerated. Key studies on lidocaine patch combination therapy used real-world designs. Patients who did not respond to monotherapy were given an add-on treatment, mimicking clinical practice. This approach provides valuable insights into how these therapies work outside of tightly controlled clinical trials. The results consistently show that adding a lidocaine patch to gabapentinoid therapy can deliver meaningful pain relief for patients struggling with neuropathic pain. Patients who received combination therapy with gabapentinoids and lidocaine patches reported up to a 48% reduction in pain intensity compared to baseline. These improvements were not only statistically significant, but also clinically meaningful, translating into better sleep, mood, and daily functioning. The ability to achieve such results with minimal added risk makes this combination particularly valuable for those with persistent neuropathic pain. One of the standout features of lidocaine patches is their safety profile. Most adverse events are mild, such as local skin irritation, and serious systemic side effects are rare. Unlike systemic drugs, lidocaine patches do not significantly interact with other medications, making them a safe addition to existing pain regimens. This allows patients to benefit from enhanced pain relief without the worry of increased systemic toxicity. Another advantage of adding lidocaine patches is the potential to reduce the dose of systemic medications like gabapentinoids. In some studies, patients were able to lower or even discontinue their oral medication after starting combination therapy, while still maintaining effective pain control. This not only reduces the risk of side effects, but also simplifies the treatment regimen for patients. Combination therapy with lidocaine patches has been shown to improve patient satisfaction and overall quality of life. Patients report better sleep, improved mood, and greater ability to participate in daily activities. These benefits go beyond pain relief, addressing the broader impact of neuropathic pain on well-being and daily functioning. Beyond clinical trials, real-world studies and retrospective analyses support the effectiveness of lidocaine patches as an add-on therapy. Patients with various types of neuropathic pain, including cancer-related pain and localized nerve pain, have experienced meaningful improvements when lidocaine patches were added to their treatment plans. These findings reinforce the value of multimodal therapy in everyday practice. Lidocaine patches come in several formulations, including 5% and 1.8% strengths. Despite differences in thickness, adhesive, and flexibility, these patches are bioequivalent, meaning they deliver the same amount of lidocaine to the skin. Some newer patches offer improved adhesion and comfort, making them easier to use in daily life. Patients and clinicians can choose the option that best fits their needs without sacrificing efficacy. Major clinical guidelines now recommend lidocaine patches as a first or second-line therapy for neuropathic pain, particularly for localized conditions like postherpetic neuralgia and diabetic neuropathy. These recommendations are based on strong evidence for both efficacy and safety, making lidocaine patches a cornerstone of modern pain management strategies. While the evidence for lidocaine patches is strong, most combination therapy studies are not randomized or placebo-controlled. This means more high-quality research is needed to confirm these findings and explore new ways to optimize multimodal therapy. Ongoing studies will help refine treatment protocols and ensure the best outcomes for patients with neuropathic pain. Lidocaine patches are not limited to diabetic neuropathy or postherpetic neuralgia. Studies have shown benefits in other types of localized neuropathic pain, including cancer-related pain and pain after surgery or injury. This versatility makes lidocaine patches a valuable tool in the broader management of chronic pain conditions. Not every patient with neuropathic pain will benefit equally from lidocaine patches. The best candidates are those with localized pain that can be easily covered by a patch. Patients with widespread or deep-seated pain may require other approaches. Careful assessment and individualized treatment planning are key to maximizing the benefits of multimodal therapy. For optimal results, patients should apply lidocaine patches to clean, dry skin over the area of maximal pain. Patches can typically be worn for up to 12 or 24 hours, depending on the product. It's important to follow dosing instructions and rotate application sites to minimize skin irritation. These simple steps can help patients get the most benefit from their therapy. Most side effects from lidocaine patches are mild and manageable. Patients may experience redness, itching, or rash at the application site. These symptoms usually resolve on their own, but if they persist, patients should consult their healthcare provider. Serious allergic reactions are rare. Overall, the safety profile of lidocaine patches is favorable compared to systemic medications. Lidocaine patches are available in both brand name and generic forms, making them accessible to a wide range of patients. Insurance coverage varies, so patients should check with their providers about costs and options. The availability of different patch types allows for flexibility in choosing the most suitable product for each individual. Many patients have shared positive experiences with lidocaine patches, describing significant improvements in pain, sleep, and daily activities. These real-world stories highlight the transformative potential of multimodal therapy and the importance of individualized care in managing chronic pain. Healthcare providers play a crucial role in guiding patients through the complexities of neuropathic pain management. By staying informed about the latest evidence and treatment options, clinicians can help patients find the safest and most effective therapies, including the use of lidocaine patches as part of a multimodal approach. In summary, combination therapy with gabapentinoids and lidocaine patches offers a promising solution for patients with neuropathic pain who do not respond to monotherapy. This approach provides significant pain relief, a favorable safety profile, and the potential for dose reduction of systemic drugs. Lidocaine patches are now recognized as a valuable component of multimodal pain management. As research continues, the role of multimodal therapies, including lidocaine patches, will likely expand. Ongoing studies aim to refine treatment protocols and identify which patients benefit most from specific combinations. The future of neuropathic pain management is moving toward personalized, safer, and more effective care, ensuring that every patient has the best chance for meaningful relief.